Okay, so imagine this. You're a doctor, right? And you're in Canada in 1914.
Okay.
So you spent your career, you know, delivering babies, you've been treating illnesses, and all of a sudden World War I breaks out.
Hmm.
And Canada, this nation with like a tiny standing army of just 3,000,
Right.
they find themselves thrust onto the front lines of this like massive global conflict.
Yeah.
And along with those soldiers go the doctors,
Yeah.
leaving their comfy practices behind and facing the horrors of the trenches.
It's a wild story.
It really is.
And it's a story of incredible transformation, both for the medical profession and for Canada as a whole.
Absolutely.
We are going to dive deep into the world of Canadian military medicine during World War I.
I love it.
And we are going to be using excerpts from Dan Snow's History Hit podcast.
Great podcast.
Yeah, great podcast featuring historian Tim Cook,
Yeah.
who wrote a fascinating book called Lifesavers and Body Snatchers, Medical Care and the Struggle for Survival in the Great War.
I mean, even the title itself,
Right.
Lifesavers and Body Snatchers.
Yeah.
It just kind of hints at those incredible challenges and ethical dilemmas that these doctors faced.
For sure.
I mean, can you imagine going from, treating everyday illnesses to suddenly dealing with these horrific injuries
Yeah.
of trench warfare?
It's a real baptism by fire.
Yeah,
You have to remember that before the war, Canada's medical corps was basically non-existent.
right.
So suddenly they had to equip and train medical personnel for a force that eventually ballooned to 620,000 people.
Wow, 620,000.
That's almost 1 in 3 adult males in Canada at the time.
That's a huge chunk of the population.
Yeah, it's staggering.
And it must have been just absolute chaos.
Oh yeah, for sure it was.
I can't even imagine.
Half of all Canadian doctors enlisted.
Wow.
And they were thrust into this leadership role. They were suddenly responsible for the physical and mental well-being of all these young men facing just unimaginable conditions.
Yeah, let's talk about those conditions for a second.
Sure.
Trench warfare. I mean, it was just brutal, unlike anything that had been seen before in history.
Yeah.
What kind of injuries were these doctors even dealing with?
Oh, man. You name it. It was everything you can imagine and worse.
I mean, like, what specifically are we talking?
Okay, so shattered bones from artillery fire, horrific shrapnel wounds,
Okay.
and then you have chemical weapons, mustard gas, chlorine gas,
Right.
causing severe burns and lung damage.
It's just hard to even fathom the scale of it.
It's really hard.
And on top of all that, this was before antibiotics, right?
Yeah, that's right.
So infection must have been a constant threat.
Oh, absolutely. Even simple procedures that we just take for granted today.
Right.
They carried enormous risks back then.
So how did they even cope with all of this?
Yeah.
How did they begin to treat these injuries with such limited resources and, such limited knowledge at the time?
Well, I think, that saying necessity is the mother of invention.
Right.
It really comes into play here because the sheer volume of casualties forced this really rapid evolution in medical practices.
So give me an example, how do things actually change because of this?
Okay, well, take the triage system, for example.
Okay.
This whole concept of prioritizing treatment based on how severe someone's injuries are,
Yeah.
that's a direct result of the overwhelming demands of trench warfare.
So they were having to make these impossible choices.
They had to choose who gets treated first, knowing that some might not make it at all.
Wow. That's a heavy burden to bear.
Really heavy.
It must have been incredibly traumatic, for the doctors themselves.
Yeah, definitely.
Even beyond the patients that they were treating.
Absolutely. But they persevered.
I mean, they had to.
Yeah, they were driven by that need to save as many lives as possible.
Right.
And in the process, they ended up pioneering some really groundbreaking techniques.
Like what?
Well, for example, blood transfusions,
Okay.
which were still in their infancy at the time.
Right.
They became much more common on the battlefields,
I see.
but they had to overcome all kinds of challenges.
Like what kind of challenges?
Well, figuring out blood typing, preventing contamination,
Right.
and then just the logistics of developing ways to store and transport blood in the field.
Right. So they're in the trenches and they're trying to figure out how to
Yeah.
store blood.
Exactly. It was a huge undertaking.
So they weren't just, patching people up.
No.
They were actually pushing the boundaries of medical knowledge.
They really had to.
Wow.
And another example is the use of x-rays.
Okay.
Before the war, this technology was relatively new,
Okay.
and it was mostly confined to hospitals.
Right.
But on the battlefields, it became absolutely essential for locating shrapnel and diagnosing fractures.
Okay.
And Canadian doctors, they became experts in using and interpreting x-rays, often in these makeshift mobile units right near the front lines.
Wow. So they're basically like creating these mini hospitals
Yeah, basically.
in the trenches.
Yeah, they had to innovate and adapt to the conditions.
It's really incredible.
It is.
So it's amazing to think that these innovations, you know, that were born out of the necessity of war, they actually went on to revolutionize civilian medicine.
Oh, absolutely. Yeah,
Yeah.
the skills and techniques that these doctors developed in the trenches, I mean, they had a profound impact on healthcare back home.
But it wasn't just the surgical advancements,
Yeah.
right? They also made some really significant strides in public health.
Yeah.
Now, that might seem surprising at first.
Yeah.
How did a war, filled with death and destruction, how did that lead to improvements in public health?
Well, you have to consider the conditions in the trenches.
Right.
It wasn't just the fighting that was deadly.
Okay.
I mean, these were incredibly unsanitary environments.
Yeah, I can imagine.
You had rats slice open latrines. It was
Yeah.
just a breeding ground for disease.
It's funny you mention that because I remember Tim Cook talking about this on the podcast, and he described the trenches as like a living hell.
Oh, yeah.
And not just because of the enemy fire.
No, exactly. And, diseases like typhus, typhoid fever, dysentery, they were rampant.
Wow.
And in fact, in those early years of the war, more soldiers were actually dying from disease than from combat wounds.
That's insane.
It's a chilling statistic.
So how did Canadian doctors even begin to address this like public health crisis?
Well, they recognized that prevention was key.
Okay.
So they implemented these really strict hygiene protocols. They launched these massive vaccination campaigns.
Wow.
And they just focused on improving sanitation as much as possible.
So in a way, they were kind of fighting a war on two fronts.
Yeah.
Against the enemy and against disease.
Exactly. And you know what? Their efforts paid off.
Oh, good.
Yeah. Deaths from disease, they dropped significantly.
That's great.
It is. And these successes, they had a lasting impact.
In what way?
Well, when these doctors returned home, they brought with them this renewed focus on public health.
Makes sense.
And this led to advances in areas like, maternal health and the fight against tuberculosis.
It's incredible to think that something so positive could emerge from such a horrific experience.
It really is.
But, our source material, it also delves into a bit of a darker side of this whole medical transformation.
Yeah.
Ann Cook, he calls this the body snatchers.
Yeah, this is where we really confront some of those ethical complexities of wartime medicine.
Right.
Driven by this need to understand these new and devastating injuries. Canadian doctors, they participated in a program to harvest organs from deceased soldiers.
So these soldiers who had already sacrificed so much, they were essentially being used for medical research without their consent.
Yeah, that's really the crux of the ethical dilemma here.
It's a tough one.
It is. At the time, there was no concept of informed consent as we understand it today.
Right.
The prevailing view is that the needs of the many, they outweighed the individual's right to bodily autonomy.
Especially in wartime, I guess.
Especially in wartime, yeah.
Yeah, it's a difficult concept to grapple with, especially from our modern perspective.
It really is.
But it seems like these doctors, they were truly caught in a moral bind.
Oh, on the one hand, they were trying to save lives.
Right.
And advance medical knowledge, which could potentially benefit countless others.
Right.
But on the other hand, they were engaging in practices that we would now consider, highly unethical.
For sure.
So it raises all these questions, about the limits of scientific inquiry.
Right.
The balance between individual rights and the collective good.
It's interesting.
It is, and those are questions that we still grapple with today.
That we still grapple with. Yeah, it's fascinating.
It is.
Speaking of grappling with difficult questions, the war also brought about, this whole new understanding of the psychological impact of combat.
Oh, yeah, absolutely.
I mean, we're talking about what we now call PTSD.
Right.
But back then, it was known as shell shock.
Yeah.
Yeah, and it was often seen as like a weakness, like a sign of cowardice.
Oh, yeah.
Rather than a legitimate medical condition.
Absolutely. There was a lot of stigma associated with shell shock.
It's hard to believe that wasn't that long ago.
I know, it's crazy.
And doctors, they really struggle to understand its causes and how to effectively treat it.
Yeah.
Some believed it was purely psychological, right?
Yeah. They thought it was just a result of cowardice or weak character.
Wow.
But others, they recognized that it actually stemmed from the physical and emotional trauma of war.
Right.
The constant bombardment, the horrific sights and sounds.
So how did they approach treatment?
Well, the approaches varied pretty widely.
No.
Some doctors, they favored rest and compassionate care, using talking therapies that encouraged soldiers to process their experiences.
Okay.
But others, they resorted to some more drastic measures like electric shock therapy,
Oh, wow.
which we now know was not only ineffective, but also really harmful.
Yeah.
It's pretty disturbing.
It's scary to think about.
Yeah, it really reflects the limited understanding of mental health at the time.
Right. It's a reminder that medical knowledge is constantly evolving.
Absolutely.
And, what was considered acceptable practice in the past might seem barbaric today.
Yeah, totally. And the debate over how to best treat, the invisible wounds of war, what we now call PTSD,
Right.
it continues to this day.
So it's clear that the experiences of these Canadian doctors in World War I had a lasting impact,
It did?
not just on the medical field, but on society as a whole.
For sure.
Their contributions extended far beyond the battlefield.
Absolutely.
They revolutionized surgical techniques, they advanced public health practices, and they really paved the way for a better understanding of mental health.
They really did.
But their story also highlights those ethical complexities of wartime medicine, those difficult choices they had to make,
Yeah,
and those questions that still resonate with us today.
really do.
You know what struck me most in this whole deep dive
What's that?
was the resilience of these doctors.
Hmm.
I mean, they faced just unimaginable challenges,
Right.
but they adapted, they innovated, and ultimately they transformed Canadian healthcare for the better.
They really did. It's a testament to the human spirit, that
Yeah.
ability to persevere even in like the darkest of times.
Absolutely.
And it leaves us with much to ponder.
Yeah.
How do we balance the pursuit of medical knowledge with that ethical imperative to protect individual rights?
Yeah, how do we make sure that, the lessons learned in war are actually carried forward to create a more peaceful and just world?
Big questions.
Huge questions. And I think it's important for all of us to continue engaging with them, to learn from the past,
Yeah,
and to apply those lessons to the challenges we face today.
for sure.
If you found this deep dive into the world of Canadian military medicine during World War I as thought-provoking as we did, consider subscribing to the show.
Yeah, we'd love to have you.
We're always exploring fascinating topics, uncovering hidden histories, and connecting the past to the present
Always.
with ways that will hopefully surprise and enlighten you.
Yeah.
So until next time,
Yeah,
keep exploring, keep questioning, and keep diving deep.
I like it.